Hey, have you ever heard the expression, the money is in the list or the fortune is in the follow up? Today, what I'd like to do is go through with you some of the reasons why healthcare practitioners miss out on being able to stay in touch with their clients and being able to actually create more streams of revenue. So, I'm going to step over onto my iPad over here. The reason why this is so important is because unfortunately practitioners think that they have their electronic health records or their EHR, and that takes care of creating the email list of clients. And in one respect, that is true. You have a list of clients. However, what you do not have is permission to send them marketing emails. And so I want to distinguish between your list that you have in your electronic health records, which are for administrative purposes. It's not for sending sequences and campaigns and marketing emails. So this is what I want to clarify for you. And hopefully when you understand the difference, you will be inspired to actually take action. I'm going to give you some steps here so that you can start building a permission-based email list in order to communicate with your clients, and perhaps even create a way for people who aren't clients, but they can become customers of your products and things that you promote. And that way you can distinguish between generating revenue from people that actually see you face to face and revenue from people who you may never meet, but because they're on your email list, because they've seen you online, they're able to purchase things that you promote. So first, let's just talk about what I call the ER trap. And so what you have right now is you have patient emails that are stored in your electronic health records. And that is only for you to be able to communicate things like appointment reminders and billing and clinical communication. This is typically HIPAA compliant so that you are protecting their data, they're secure so that you're not giving away any of their personal information, that kind of stuff. And that's important, and we're not going to get rid of that. That is essential that you have that for your practice. But what I'm talking about is having permission-based email marketing. So this is so that you're able to communicate with them outside of perhaps the types of appointments, because they may not be a client yet. They may be, like I said, a customer. They may be just checking you out. The idea here is that people are able to subscribe, that is, opt in, and say that they want to hear from you. And this is a good thing. They want to learn more about the type of information that you provide, and they want to learn the types of things that you have expertise in. So these are, like I said, not just your patients, and the information that you can exchange in there can have a pretty wide range. And there is a crucial difference between having these emails for administrative purposes versus having them for marketing, because when you have it as a list, this becomes a valuable asset for your business. If you ever think about selling your practice at some point, the number of people on your email list and how well you have nurtured them, how well you have stayed in touch with them, and how consistently you've emailed them and they've emailed you back is a really important aspect to your business. So the EHR, just so you know, your EHR, it's not designed to build relationships. It's a one-way street where you're communicating with them about their appointments and that kind of stuff, versus your email marketing is designed to create engagement and to develop those relationships that can last a long, long time. So hopefully you can understand there's a difference here. And so we need to find a way to build that list. And I want to give you some reasons why, so you can start thinking about this. So one of the reasons why is because I just mentioned you have ownership and you have control over your email list that you build. And I'm going to back up for just a second here. When I set up here, people opt in, right? They opt in, they subscribe because they want to hear from you. when you have permission-based email, they also can opt out. So they can unsubscribe and leave the list if they don't want to hear from you anymore. And that's the whole point here, because there are legal ramifications if you do not give them the ability to opt out. So there's something that the Federal Trade Commission, the FTC, enforces, which is called the CAN-SPAM Act, if you've ever heard of it. It is an actual legal act that if you do not have certain parts of your email software that automatically allows people to unsubscribe, then you are violating that act. And so you need to have things like an email. You have to have a physical mailing address connected to your email software. And so you need to have some of these things in place so that you can't just spam people, which is really strange, isn't it, given that how much spam we all get? I don't know why. Like, it's not all fixed, but the point is that when you send emails, you want to do it from your business, your business account, your business domain, and you want to have a good sender reputation. And so following the rules of the CAN-SPAM Act are really important. And so that's why it's important to have separate email software that is not your EHR. I talk to a number of practitioners, and they often think that because they have their list, they have their email addresses in a list in their EHR, that they can then send marketing emails. And there are some EHR programs that actually give you the ability to send, like a broadcast email. And I would say that is not a great idea to get into the habit of that. Maybe occasionally when you're going to be out of the office or there's an emergency and you want to, contact everybody, sure. But to send actual marketing campaigns, which is a series of emails that is leading to a certain, promotion, that I would recommend that you look into, and I'll give you some suggestions, dedicated software that is specifically for emailing sequences and broadcasts and tagging, and has the CAN-SPAM Act taken care of for you. So all those things are, in fact, the proper email software won't even let you send out emails unless you have all the things in place. So having said that, let's talk about 5 reasons why you want to build your email list. There's a lot. I'm just going to narrow it down to 5. So I alluded to this before, like, you have ownership and you have control over your email list. And it's a direct line of communication that you because you have control of it, nobody can take it away. And the contrast to this is, if you think about social media connections, if Facebook goes down or Instagram goes down and you're used to private messaging or direct messaging people, if those things disappear or your account gets shut down or closed, then you have no way to contact those people. And I have heard horror stories from people who've lost thousands and thousands of connections with people when Facebook has just closed them down. And so you have no control over that. And when you don't have control over being able to connect with your people, that is a huge disadvantage. So you do not have to worry about the algorithm when you own your own email list. You own it yourself. So if something goes awry, social media platforms go down, you still have your list. Now, is it, totally preventable? I mean, is there any way that you could lose your email list? Probably not, because you back it up, but there can be times when there are outages when you can't email. Those kinds of things can happen, but you still own the list. You still own the email addresses, especially if you're doing backups properly. So you have all that kind of stuff. So this, to me, is one of the biggest things. If you have to close your practice, if you decide to close your practice and retire, you still have that email list and you can still communicate with those people. As long as they have given you permission, you're able to do that. So this is a big, big deal. The second thing here is permission-based email. Again, people opt in because they're interested. They want to know what you have to say. And they expect those email messages from you. They welcome them. They want you in their inbox. So that's the fun part with this, is that you are communicating with people and you're creating a community. So that's a big deal. You're building trust. So in online marketing and digital marketing, we talk about this thing called the know, like, and trust factor. So through email marketing and through regular communication, you're building these relationships that aren't just dependent on them coming in and seeing you one-to-one, but you are able to create these deeper connections. And it depends on what kind of emails you're sending, but if you include some personalized information, some things about your pets or your spouse or where you're traveling, those kinds of things are ways to connect with people on different levels. And so it does build trust. It also, I know that I used to put out a newsletter, and I would talk about my dogs, my cats, that kind of stuff. And people, when the patients, when they'd come in, some of the first things they'd say to me is, I read your email, I read your newsletter, and, this happened to my pet too. And so we'd have the conversation around that. So it's a different level of communication and a different level of connection. I'll say also around this is that oftentimes patients will forward those emails, and you can even encourage them in the email if you have a certain type of information in that email. Like maybe you wrote an email that's about Chinese herbal medicine and reducing pain naturally for women with fibromyalgia. And you just had a little article on that you had written up because you learned some new techniques or some new information, and you wanted to share that with your list for anybody that was in pain and had fibromyalgia. What you could do is say, do you know anyone who's dealing with this? Please go ahead and forward this email. So this is a way to expand your reach and build that trust in that way. I mentioned this before, that this is a valuable asset, and there are actually calculations that are made based on the number of people on your list and the dollar amounts that you can generate through that list. So if you ever wanted to sell your practice as well as your web platform, and I talk about this in some of my other videos, your email list and the number of people on there is part of that calculation and increases the value of your overall business, and how that would be estimated. The value of that would be estimated. Number 5 here is future opportunities. So you share information, offer products, and let people know about events in a natural and helpful way. So if you're attending, a health fair, or you're giving a talk somewhere and you want to invite them, this is a great way to stay in touch with people and let them know. This is a big one here, is offering products. So, if you've ever been around a Black Friday and you get a lot of emails, you know that there are opportunities there for you to let people know about products that you've researched and that you use and that you recommend and that you notice are on sale. And they love the fact that you've researched them, you're using them for health and wellness, you're using them in your own home and with your family, and you're letting them know that they're on sale right now and where they can go pick them up. And so you can use something called an affiliate link to share that in an email. And again, affiliate links and affiliate commissions is a way that you can promote other people's products without having to create your own. You don't have to do the shipping or anything like that. A very common example that I give of being an affiliate for a company is being an affiliate for Amazon. And of course, people trust Amazon to deliver their products quickly, and they have their credit card on file there. So there's a lot of reasons why being an affiliate for Amazon can be really beneficial. And Amazon has changed their policies in the last year or so. I mean, it was relatively recently they changed their policy so that you can now put affiliate links in emails, whereas before you were not allowed to do that, provided that it is permission based, right? You have to prove, if there's ever an issue, that you are emailing through a permission-based email system where they have the ability to unsubscribe. You then can use Amazon affiliate links. And I have a whole training on how to use Amazon the right way for healthcare practitioners, how to not get your account closed down. I will link to that. It's currently a free training, and that will likely change, but you can check the link in the description, and if it's still free, have at it. You can enjoy it. It's a really I've seen so many practitioners get kicked out of the Amazon affiliate program because they make some very avoidable mistakes, and so I want to make sure that you do it the right way. So it's a great training for that. So let's talk about the differences again between the EHR and your creating a email list that you control. So it's for you, you're thinking about it differently. You're thinking about it, your EHR, you're the administrative kind of way of using emails, and you're using it for clinical records. This is very transactional. And again, I said this is one-way communication where you're the one reminding them about appointments and kind of letting them know what's going on in your world, if there's going to be a change in schedule or something like that. Versus when you are doing email marketing, your mindset is different. You're actually trying to create an engagement. You're trying to build a relationship. And so encouraging that two-way communication in there. So again, it's just this shift in mindset from using the emails administratively to building like true marketing and how you connect with your community. And even this idea of creating a community is really important here. So the important thing here is being able to create an email consistency where you are consistently touching base with them. So how do you start building your email list? I just broke it down into these 4 steps. So choose your tool. And I said before that this should be dedicated email software. A lot of the ones that are reputable are going to be the ones that you hear about most frequently. The difference is on how easy they are, and I'm going to do in quotes, they are to use. One of my favorite ones is MailerLite, especially for beginners, because they have, based on the number of subscribers that you have, the price changes, and they have a really good starter kind of free plan. And I think their training videos are really good. And they also make sure that you are following all the rules. So that's one of the ones that I like a lot. And I've been through a lot of them over the years. I've used just about every one of them. I mean, not all of them, but a lot of them. Some of them aren't even in business anymore. I've been around so long using them. Personally, I think that when you're doing email marketing and you're thinking in a more expanded way, which is how I want you to think, I like having the email software connected into my web platform. So there are certain types of website building software that includes the email in there. And that's what we call a CRM or a customer relationship management system. Those are really the best if you have an entire like CRM. This video, I'm not going to go into that. So if you were just looking at specific software, MailerLite is good. A lot of people use MailChimp. I'm not a fan of MailChimp. Just it's a personal thing. You know, I don't think it's as easy to use it or as intuitive as something like MailerLite. And MailerLite is also less expensive, at least at the time of this video. I don't know. Prices are always changing. And there are a bunch of other ones that are out there that can do some pretty magnificent things as far as, you know, tagging and segmenting based on what behaviors your subscribers are doing. And again, that's where a CRM, you know, really comes in, is being able to track what subscribers are doing. So if you have questions about email software or anything like that, or about web platform software or CRMs, go ahead and ask me in the comments below, and I'll be happy to reach out to you or to create another video that can give you some of this information. So you choose your tool. In this case, I'm going to say, you know, something like MailerLite. And actually, the CRM that I recommend is you can actually start building your list for free. You can actually create a what I call a funnel and start getting subscribers and get that whole ball rolling without any cost at all. And then once you're at a point where you want to expand on that because you've gotten enough proof that it works and enough practice and you've gotten familiar enough with the system, then you start paying. So that's something that I would recommend. And again, I'm not going to go into it right now, but that's an option. And I'll say, so you have no excuse. You can't use it. I can't afford it as an excuse to not do this because there are free ways to do this. So you can invite your patients, and I do recommend inviting your patients to join your email list. I mean, why wouldn't you? You're taking them from then the clinical EHR place, and you're asking them to get on your email list, which is education based and is you're providing that kind of different information that maybe you don't have time to provide in the context of the one-on-one, treatment. So it's really great to get them onto your list and to invite them. There are some ways to do this that make it part of your routine, like train your staff. You can train your staff when they're coming in for the first time. Ask them if they would like to subscribe to your newsletter. And there's other ways to do this that make it even more enticing. Subscribe to my newsletter is not very enticing unless you're letting them know what the benefits are of of receiving that newsletter. And we often will talk about giving away something of value for free. Like, would you like my checklist of foods and natural remedies for fibromyalgia pain? Here, you can download it here. I have it written up on a PDF. You can have it on your phone. You can take it to the grocery store so you see what foods and supplements I recommend that are great for reducing fibromyalgia pain. Something like that, then you're giving away something of value for free. We call that a lead magnet. And so you can give that to your patients or offer that to your patients, invite them to download that in exchange for their email address. That is a very legitimate and often used way to build an email list. And also, when you have something like that available on your website or your web platform, then anyone anywhere in the world who has fibromyalgia pain and wants to know what foods and what natural remedies there are out there that could help them, they would also be interested in that. And I think in the next video, I will go into more details on how you can create a lead magnet to help you build an email list. Because I'm going to also give you some more reasons why this is very beneficial. You should also set clear expectations so that you're transparent in what it is and how often you're going to be communicating with them. So how often you're going to be emailing them. I know that whenever I talk to practitioners about this, one of the first things they will say is, I'm afraid I will be emailing too frequently. And I think we take our personal feelings of hating to get a whole bunch of email and feeling like, oh, I'm going to be bothering them. I'm going to be bothering my patients if I email too frequently. Guess what? If you bother them and they don't want your emails, they'll unsubscribe, and that's fine. That's okay. That's part of this whole process here is they get to decide. They have the choice. But if you're not emailing enough, then you're not doing this other part, which is that building trust by having consistent communication and nurturing your email list. So this is part of the problem of the mindset that I shouldn't be emailing too much or I might be bothering them or anything like that. And I will refer back to Black Friday. If you've ever been part of other companies that you like, and Black Friday comes along and they want to let you know, this is what you're going to get. This is the best price ever. It's going to end soon. You better do it now. You get just a deluge of emails. And so I'm not suggesting you do that unless you're doing an actual marketing campaign for something. But having consistent communication is a really important part of this whole process. So don't be afraid to be consistent with emails. Emailing once a week would be a minimum. I would recommend. That's a really nice way to stay in touch, and you can always do it depending on who you're emailing to. But I know there have been people who have their primary target market that they work with, or their primary patient population might be moms with young children, and it seems like Sundays are the best time. Sunday late in the day is a great time to send out an email. They get a really good open rate then, and that's a good time. But your population of people might be a Tuesday at noon. You don't know until you start emailing, and you can find out like when is a really good time that they're able to sit down and read what it is that you're sending them. Or you could send them randomly. I mean, I recommend that you have a regular routine and are consistent, but when something comes up in the news that you want to comment on or let people know about, you can also be that, have that kind of spontaneous communication, and that's always good to do that too. So the other phrase that I brought up at the beginning of this video is, I said the money is in the list and the fortune is in the follow-up. So let's talk about this a little bit. So being able to establish a regular routine in communicating with people is a way to build this community. And as I said before, this isn't this one-time thing where you're just going to send a broadcast or just one kind of thing like, hey, instead, what you want to do is think about it as you're telling a story over time. And so you create these sequences or these campaigns. And because you have an email software system that has automations in there, you can create a campaign that's spread out over the period of 7 to 10 days or 7 to 10 weeks, however you're putting this together. And they will automatically go out so that you're not working and doing this like every week. You can, and there are great times to do that if you are a good writer and you like doing that. Or with AI tools right now, you can just speak and it will write the email for you. So there's a lot of different ways to, so this is not very time consuming. So this is the idea, is that you are nurturing an ongoing relationship, and that's the mentality that you have here. When you consistently provide value, your audience becomes genuinely excited to hear from you. These are the people that you want to be able to communicate with, the people that really want to hear about your expertise and what you're interested in, and the types of tools that you have available to them, the types of lab testing that you offer, the types of treatments that you provide, the skills that you're learning. Maybe you just, learned a new technique or have access to new devices that can help them. They want to hear about this. So this is where it's exciting, and truthfully, this is where the magic happens. You have something to share or promote. You're not interrupting them. You're continuing that conversation with people who know, like, and trust you. And that's what you've been building over time. And I haven't spoken too much about, promoting products, but this is part of the reason, I will say, with email marketing, is that when you have something to promote, you have people already, listening. They're already on your list, and they want to know what it is that you have to offer. I'll say this as well. I mentioned this in the very beginning, is that your list is an asset, and it is a legacy that you can continue with even after you leave your practice or close your practice or move to another location or retire completely. That when you have this list, this is a valuable asset. And I talked about, you could sell it with your practice and it becomes part of how that asset is valued. You can also take it with you and continue to communicate with this community and develop it in another way where you are continuing to provide great information and promote products. They can be your products, things that you've created, or they can be other people's products. As I mentioned before, you can be an affiliate and be promoting products that you've researched. So I think that the trap that many practitioners fall into is thinking that their electronic health record is their email list, and so they don't have to think about this or worry about this. And then because they think they already have an email list, they don't watch videos like this because they're like, why should I? I already have an email list. But that's not true. You don't have a list of subscribers that want to hear from you and that you're following the rules and have the legal ability to send promotions to. And I want to share one other thing here if I can. Let's see if I can bring this up. I went ahead and I took a look at, I don't know if you've ever looked at Perplexity. It is an AI tool. Let me make this a little bit bigger here for you. And I just went in and I asked the question. Perplexity is an AI tool, and they're really great about providing sources. So some AI tools will kind of hallucinate and make up stuff when you ask them questions. And so Perplexity is nice if you're doing real research and you want cited sources for data. And so I just asked, how do you value an email list? And so in here is saying that industry benchmarks, so I'm over here, industry benchmarks often cite about $1 to $2 of revenue per subscriber per month for well-run lists. And well-run lists here are going to be lists that there is consistent communication, meaning 1,000 subscriber list might generate roughly $1,000 to $2,000 per month under good conditions. Okay, there's so many variables here, so I don't want you to take this, like this is written in stone. I'm just trying to give you a realistic sort of way to think about this. Here's another one. Some analyses that divide annual email revenue by subscriber count find lower but still meaningful figures like $25 to $40 per subscriber per year in certain businesses. So that's quite a difference, but it's just giving you an idea. So you should think about this as another way to generate revenue. And so I often will talk about, I never think about a website or web platform as something that is an expense. It is an investment that pays you back. And the same is with your email software. It's not an expense. It is something that is generating revenue and is paying you back. There's a way you can estimate this here, and it's useful information. And then I also asked the question, how many follow-up emails basically does it take for a customer to make a purchase? And this is what I want to do is I want to ease your mind when you feel like, oh no, I'm emailing my people too often. I'm afraid they're going to unsubscribe or any of that kind of stuff. And the truth is that people need, this is based on research. Customers need follow-ups. They need to see you more than once, oftentimes, in order to purchase or to take action. So if in your email, your call to action is to call and schedule with you, or to follow you on your YouTube channel, or to purchase a red light device that you've researched, they need to see that information more than once. And so the data shows that about 5 follow-ups before a customer buys, but it really falls somewhere in between, closer to 12 follow-ups. So I'll just kind of add this in here. Only about 2% of sales happen on the first contact. Around 80% of sales close the sale, happen 5 to 12 follow-ups. So how many of you give up after 1 or 2 emails that you send out, and then you're like, oh no, I'm bothering them, I don't want to send any more? You might need 12. And follow-ups, because we live in this interconnected interweb of influence here, then you should use all channels, not just email. Use your social media, use video, use all the different ways, talk to them. So I just want you to see that there's much more follow-up than you probably imagine. Several analyses report 80% of sales need at least 5 follow-ups, yet reps stop after 1 to 3 attempts. So if your competitors, if we look at it that way, and I don't, but if your colleagues are promoting the same things, but they're giving up after 1 or 2 or 3 emails, and you're the one out there doing 5, 6, 7, 8, 9, 10, 11, 12, then who's going to get the sale? Who's going to, get the income? You are going to do that. So I hope this has helped you to understand the value of having an email list, the value of taking the time to learn how to use email software. Every email software has a learning curve. So getting an email software where you can get support, that there's good video instruction, that is a helpful community, I think is really important. I look into all those things. And having a way for people to subscribe to your list in an ongoing basis so that it's continually growing is really important. That's where we get into creating something called a lead magnet, which is giving away something for free, something of value that people want. It does so much more than build your email list. It actually attracts targeted people that you can have really specific kinds of conversations with. And so the example that I gave earlier was, if your area of specialty is treating women with fibromyalgia, then if you have a lead magnet or something of value for free just for women with fibromyalgia, then only those people are going to be on that list. They're going to only be the ones that want to get that information. And so you now have the ability to have really specific conversations and promote very specific products around pain, around fibromyalgia, around herbs and supplements and those kinds of things, around different digital programs that you might provide that is specific to that, therapeutic exercises, very specific to that condition and that population of women. So I will talk about that in my next video, probably 2 weeks from today. So hopefully I will see you there. I appreciate you taking the time to learn this kind of stuff and to really make a difference in people's lives by doing it through building that know, like, and trust factor online with your email marketing. So again, I'm Lisa Hanfileti. If you have any questions about this video or you have any requests about other videos that can help you with your marketing, I'm here to help you do that. You have a great rest of your day, and I will see you on the next Love Your Livelihood live stream 2 weeks from today. All right, thanks.